So what is the effective date when all of this stuff is supposed to actually take into effect and be affecting their potentially working their workflow?
So it's been phased in multiple phases. So today there's pieces of DSCSA that the pharmacies are supposed to be doing. Things like making sure that they only order from licensed or suppliers with a valid license, making sure that they receive all of the data with the product, it's accurate, complete, and store that for 6 years. Make sure you have a procedure in place today that outlines what to do if you receive an illegitimate product or a suspect, something that is damaged or it's a wrong shaped pill or it looks different than the normal. Whatever. What is your procedure for quarantining that? Those are little pieces that should be in place today.
Okay.
Going to November 27, 2023 of this year, obviously, the interoperability kicks in, and that is the traceability piece of it, which is the most complicated portion of it as well. Mark, I'll turn it over to you to add.
With that interoperability phase, we go from lot level tracking to product level tracking. Every product will have its own unique serial number, and the intent is to track all those drugs throughout the supply chain. We're collecting serial numbers, of course, expiration dates, lot numbers, all of that information to be able to track that drug specifically. And we're putting guards in place, like product verification, to be able to verify that that drug you're about to sell is the drug that the manufacturer made, to make sure it's not a counterfeit.
So when I get my order,
yes.
I will scan each bottle in.
Yep, you scan that bottle. That barcode has that unique serial number for that bottle that you can confirm that's what it is and what it's supposed to be.
Yeah, we had somebody going around at Cardinal saying, hey, their feature was that you could receive your order without having to scan it.
I don't see how that's
and I would say, that's not an advanced feature. That's a wrong feature.
That's asking for an audit.
Well, no, that's just wrong. So you scan it.
For trouble.
If something is missing, right? I flag it. I'm somehow going to tell your software, hey, these were the ones that were wrong, right? When I scan it, and then I set them to the side, and then what happens?
Well, the first thing you do is you try to get a replacement data for that product.
Okay.
If there's something missing I'm sorry, Jeff. If something's missing in the data set,
right?
You try to get replacement
So you
data.
sit down and it says this serial number, and I have a different serial number.
Right.
It got picked and scanned wrong. And so what's going to happen? Am I going to, that one that I actually have, so I've basically told your software, I got this one, I didn't get this one. Is your software going to send it in and try to get the wholesaler to reconcile that?
Absolutely, yeah. That's what we call exceptions.
Okay.
Either receiving a product without data or data without a product. And those are you need to take action on those immediately. You need to get the data from the wholesaler for the product if you don't have the data. And you have to do a product verification to make sure it is what it is. Those exceptions are going to happen more often with interoperability because we're moving from using EDI data feed to this EPSIS data feed, which is a big jump for the industry. And there's going to be more mistakes, and those exceptions will be happening, and you need to be taking care of those.
Yeah, I remember one of the big things at Morrison-Dixon, when we were part of them, hung their hat on, was very high accuracy of orders, right? They would scan all their orders, where a lot of wholesalers so there definitely is, and I'm telling people I'm talking to, you know this, right? You get inaccuracies in your orders sometimes, right? And so when that happens, now, how fast is that going to be? So I got the wrong bottle, and it sends it back to your software. Does somebody have to physically do something at the other side, or do you look at the data over there and say, oh yeah, no, they have it?
Well, it depends on what the problem is. Ideally, we can fix the problem by the end of the day, so you don't have to quarantine the product for a long time. If it did initially, what you're going to do is talk to the wholesaler trading partner, get the correct data for that product. But if you can't get the correct data for that product, then it may actually be a counterfeit.
Okay,
so you need to counterfeit and report to the FDA.
Yeah, so talking to the wholesaler, does that mean I'm picking up my phone and I'm calling the wholesaler, or am I talking through your software?
talking through the software.
Okay. So the software is telling the wholesaler, hey, this would I don't have data for these
this drug
items, and
was
I don't have items
flagged.
for this data. Basically, they picked it wrong, right? They
Right.
right. They
Yeah.
put the wrong thing. They scanned
Okay.
one and put a different one in the tote, right?
Or it could be something missing. There could be something that was
Right.
taken out of the tote accidentally or
Something fell out.
Right.
Right,
Right.
right.
So in that
and you
case,
need
they
to
just
account
need
for
to
that.
remove that from my order and resend it.